In this video, we're going to talk about the oxygen-hemoglobin dissociation curve, and we will explain the commonly tested facts related to this topic. Coming next. Hello everyone and welcome to A Little Push. Today's question states, the oxygen dissociation curve is pH dependent and indicates the relationship between hemoglobin saturation and oxygen tension in the blood. When carbon dioxide is released into the blood from tissue, the blood pH is. As always, we will give a background information to answer this question and all other questions about this topic to conquer your exams. First, let's give an overview about the structure and function of hemoglobin. So in this picture, we can see that we have a normal adult hemoglobin. It's a polypeptide consisting of 2 alpha and 2 beta subunits. And embedded in these subunits, we have 4 heme iron complexes. These are the blue complexes that we have over here. The function of hemoglobin, as we all know, is to carry oxygen in the blood from the lungs all the way to the tissues. Now, if we can look at our molecule of oxygen over here, first, the binding of the first molecule of oxygen is somehow difficult, but then the subsequent molecules will bind easily. This is what is known as positive cooperativity. So the first molecule has a bit harder time to bind to the hemoglobin, and then because of the binding of the first molecule, we will have subsequent changes, and the hemoglobin will be easily able to bind to oxygen. Now let's get into the oxygen-hemoglobin dissociation curve. First, let's give an overview about this curve. We have the hemoglobin oxygen saturation seen on the y-axis. It is evaluated by percentage. We have oxygen partial pressure measured in millimeter of mercury, and we can see that S-shaped curve in this diagram as well, which is as a result of positive cooperativity that we just mentioned. First, let's take an example in which we have high oxygen concentration in the blood vessels coming out of the lungs. And normally, it will be around 104 millimeter of mercury. And in the diagram, we can see that it will correspond to approximately 98.5% of oxygen saturation. If we can take a look to the upper part of the curve, we can see that the curve is somehow flat in shape. Now, we will draw a line from the point where this flat shaped part of the curve ends. And it will correspond to 60 millimeter of mercury. And that will be around approximately 98% of oxygen saturation. Between the first point and this one, we don't see much changes in the saturation of oxygen. This is clinically relevant because normally we keep our patients above this value of 60 millimeter of mercury or 92% of oxygen saturation. Because beyond this level, we can see that the graph will change dramatically, and clinically, also beyond this cutoff point, the patient can show symptoms of oxygen deprivation like neurological damage as an example. So always keep your patient above these values. So let's take that out, and now let's see the point which corresponds to the hemoglobin in the venous system. So this will correspond to 40 millimeter of mercury, and that will be almost equal to 75% of oxygen saturation. So now we have the arterial oxygen saturation and the venous oxygen saturation. Okay? So if we want to have the tissue extraction, we can easily take the venous oxygen saturation and we will subtract it from the arterial oxygen saturation, and the result will be what the tissue consumed, i.e. the tissue extraction. So that will be in this equation as 98.5% subtracted by 75%, and we will have 23.5%. So this is the tissue oxygen extraction normally. Now let's say if we have an acidosis in the blood. In this state, the curve will be shifted to the right, as it is resembled here in this diagram by the red curve. So let's see how the oxygen saturation and tissue extraction will be affected in this way. If you want to see the first point in this curve, which is the blood vessels coming out of the lungs, again 104 mm of mercury would correspond to 93% of oxygen saturation. So we can see already that there is some difference. And also, if we want to know the venous oxygen saturation in the acidosis state, it is 40 mm of mercury, and that will correspond to 48% of oxygen saturation. So now, if we want to calculate the oxygen extraction, we'll have 93%, which is the arterial oxygen saturation, minus 48%, which is the venous oxygen saturation, and we'll have 45% of oxygen saturation. So let's add the third scenario, which is if we have an alkalosis state and the curve is shifting to the left. So what will happen in this situation? For the blood vessels coming out of the lungs, we'll have 104 mm of mercury, but this time it is corresponding to 99% of oxygen saturation. On the other hand, for the venous state, 40 mm of mercury will correspond to almost 91% of oxygen saturation. So if we want to have the oxygen tissue extraction, we'll subtract the two values, 99 minus 91%, and that will equal 8%. So what does that all mean for the right shift and the left shift? Let's remove the venous values so we can compare between the arterial ones. So first, in the normal state, in the blue box, we have the oxygen saturation of 98.5%. If we want to compare that to the orange box, which resembles the right shift, we will have an oxygen saturation of 93%. The oxygen saturation is less. So we can say that in the right shift, the hemoglobin has lower affinity for oxygen because it's binding less to it, although we are having the same concentration of oxygen in the blood. For the left shift, i.e. the green box, the partial pressure of oxygen saturation is 99%. Comparing it to the normal curve in the blue box, we can see that the hemoglobin has a slightly higher affinity for oxygen, i.e. 99% is higher than 98.5%. Now let's take a look into the oxygen tissue extractions. The oxygen tissue extraction is 45% in the orange box, compared to the normal tissue extraction presented in the blue box with a value of 23.5%. So we can say that in the right shift, presented by the orange box, there was an increase in oxygen delivery. On the other hand, for the left shift, presented by the green box, the tissue extraction is 8%. Compared to the normal, this is a lower value, so the tissues were having a decreased oxygen delivery. To sum up this slide, the right shift, which is resembled by the orange curve, we have seen that the hemoglobin has a lower affinity for oxygen and increased oxygen delivery. On the other hand, the left shift resembled by the green curve, the hemoglobin had a higher affinity for oxygen and decreased oxygen delivery. Let's focus our comparison now to the left shift versus the right shift. In the left shift, again, hemoglobin is having higher affinity for oxygen and decreased oxygen delivery. In the right shift, hemoglobin is having lower affinity for oxygen and it has an increased oxygen delivery. Now, what are the causes of left shift versus right shift? First, let's talk about the left shift. The causes are decrease in CO2 levels, decrease in hydrogen ion levels, which will present as increase in the pH and alkaline state, decrease in temperature, decrease in the molecule called 2,3-PPG, also fetal hemoglobin and myoglobin, which we will talk about it in the end of the video, and lastly, conditions like carbon monoxide and methemoglobin. For the right shift, it is the exact opposite. So the causes are increase in CO2 level, in hydrogen ions levels, in temperature, in 2-3 ppg, and conditions in which the body need increased oxygen delivery, like exercise and high altitude. So let's make an easy mnemonic to remind you of the comparison between the left shift versus the right shift, because this is usually tested heavily in many licensing exams. We will use the letters L for the left shift and R for the right shift. So left shift, less oxygen delivery, hemoglobin loves oxygen, which reflect the high affinity, low hydrogen ions, low CO2, etc. For the right shift, raised oxygen delivery, hemoglobin will releases oxygen, indicating the low affinity, and the other causes like raised hydrogen ions, raised CO2, etc. Now let's switch gears and talk about the Bohr effect versus Haldane effect. So first, the Bohr effect, it states that in response to increased acidity, i.e. increased CO2 levels, the oxygen will bind less to hemoglobin. So it's basically explaining what is happening in the peripheral tissue. In the peripheral tissue, we are having high CO2 levels, and as a result of this high CO2, oxygen will bind less to hemoglobin, and it will be released to this tissue. On the other hand, Haldane effect states that in response to increased oxygen levels, CO2 will bind less to the hemoglobin. So for Haldane effect, again, it's explaining what happens in the lungs alveoli. In the alveoli, we have a lot of oxygen. That's why hemoglobin will respond to it by binding less to CO2, releasing CO2, and getting the oxygen. So basically, if we can remember which effect Haldane or Bohr is associated with which part of the body, we can easily recall their definitions like if we are reading it from a textbook. And we came up with a cool mnemonic to remind you that Bohr effect is associated with peripheral tissue and Haldane effect is associated with lung alveoli. And that is, love of the heart is pain for the body. This is an issue of many romantic relationships. So love of the heart is pain for the body, to associate that in the lungs we can see Haldane effect and in the periphery we see Bohr effect. Lastly, at the end of this video we want to compare the normal hemoglobin, fetal hemoglobin and myoglobin. First, let's introduce you to this diagram. We have the partial pressure of oxygen, but here is in the kappa unit. The saturation of hemoglobin is in the y-axis here, myoglobin, fetal hemoglobin, and normal hemoglobin. First, what we can see is that for myoglobin, the curve is not sigmoid because myoglobin is a monomer and it does not show the positive cooperativity. Second, we want to talk about affinity. As we have seen in the previous slide, in the relationship between the right and the left shifts is that the left curve always has a higher affinity in this diagram. So here myoglobin will have the highest affinity for oxygen, then the fetal hemoglobin, hemoglobin F, and lastly the normal adult hemoglobin, hemoglobin A. And this makes sense because myoglobin is found in the muscles, right? And it should have higher affinity. So it can take the oxygen molecules from the hemoglobin, the adult hemoglobin, because at the end of the day, the function of hemoglobin is to deliver oxygen to the tissues. So that makes sense. For fetal hemoglobin, it also makes sense because when the blood vessels of the fetus and the blood vessels of the mother get across each other, the fetal hemoglobin, since it has a higher affinity, it will be able to take the oxygen from the mother hemoglobin and deliver it to the fetus cells. So again, in the terms of affinity, myoglobin has the highest affinity, then fetal hemoglobin, and lastly, normal adult hemoglobin. Another concept we need to tackle is P50. P50 is the pressure of oxygen where 50% of hemoglobin is saturated. That will correspond to this part of the diagram. If we want to draw it, this around 50%, and we want to see what is the concentration of oxygen in these curves. So for myoglobin, it's around 2. For fetal hemoglobin, it will be around 4 kappa. And for adult hemoglobin, it will be around 5 kappa. So myoglobin has the lowest P50, and for adult hemoglobin, it has the highest P50. So when they ask you about the affinity or P50, remember that they are opposite to each other. For the affinity, myoglobin has the highest affinity, then hemoglobin F, and lastly hemoglobin A. For P50, the highest is hemoglobin A, then hemoglobin F, and lastly myoglobin. Now we reach the end of our video. Let's finish up by explaining the question we have seen at the beginning. Again, the oxygen dissociation curve is pH dependent and indicates the relationship between hemoglobin saturation and oxygen tension in the blood. When CO2 is released into the blood from tissue, the blood pH is A. Reduced and the curve shifts to the right, B. Reduced and the curve shifts to the left, C. Increased and the curve shifts to the right, and D. Increased and the curve shifts to the left. So this is a two-part question. We need to know what is the blood pH and how the curve will shift. So CO2 is released, and in the blood, the CO2 level will be raised. From that, we know if we have raised CO2 level, we will have a right shift, the R with R. How about the blood pH? CO2 will affect the blood pH by reducing it. So the answer will be A. Reduced, the blood pH is reduced and the curve shifts to the right. Thank you guys for watching and see you in the next video. Salam.